So Dr. Rowen, maybe you can tell us a little bit about what oxidative therapy is.
Thank you. Oxidation therapy is a family of therapies. I would say ozone is the most broadly known and is at the top, but and ozone was done long ago in Europe, beginning in Germany. The Americans used a different form of oxidation therapy for many years called ultraviolet blood irradiation therapy. And that was pioneered by American Emmett Knott. And lots of articles were published on curing intractable, untreatable infections in the 1940s and even into the 1950s. Mm. The work on that started in the 1930s. In that therapy, Knott would take out maybe 200 cc's of blood, expose it to a very high intensity ultraviolet C generating light source, and then return that treated blood. And the results were so stunning, American authors took pains to describe the miraculous, literally miraculous recoveries of people from totally hopeless and untreatable diseases, which is going on today. When I say going on today, people are dying of untreatable antibiotic-resistant infections, and medicine won't even consider anything outside the box.
So they were using UV light to shine on the blood of patients and healing them that way. So that's a form of oxidation?
That's a form of oxidation. Oxidation literally means pulling an electron. That's what oxidation is, pulling off an electron. That's what oxygen does. It sucks electrons. Mm. Reduction is putting in electrons. So, let's look at the difference between a cancer cell and a normal cell. Mm-hmm. Cancer cells don't use oxygen very well. That's well known. Mm-hmm. So they are loaded with electrons. They're in a state of what we call redosis. They're loaded with electrons. And your normal cell, your muscle cell that's working, is burning oxygen, and that oxygen is hauling away electrons. So it's going to be more electron poor. And we want that because with oxygen working properly, you make energy, you make ATP. And that's what your body, that's the energy source that your body needs to run with. And if your mitochondria are not working, for instance, after a COVID vaccine or maybe long haul COVID, your body is not utilizing that oxygen to make energy. And you get sluggish, you get brain fog, all kinds of bad things happen. So that's the difference between oxidation and reduction. Cancer is a state of reduction. Normal health is a state of oxygen utilization, and it's a state of being oxidized. And ozone oxidizes. Ultraviolet blood irradiation kicks electrons off, so that's considered oxidation. Hydrogen peroxide therapy is oxidation. You can give hydrogen peroxide intravenously. There's advantages and disadvantages to all these, which we can discuss. Mm-hmm. And then there's another form which most people will not register with because they think it's an antioxidant, and it's high-dose intravenous vitamin C. Mm. Everybody thinks of intravenous vitamin C as an antioxidant. Yes, in low doses, I guess it is, but a team at the NIH, I think it was run by Mark Levine, found that vitamin C works in high doses, which you can only get intravenously, by a totally different mechanism. It's a prodrug for the creation of hydrogen peroxide in your tissues. Mm. So when you take an IV, say, of 25 grams of hydrogen peroxide, you're increasing the production in your tissues of hydrogen peroxide, which is probably what's doing the work.
Mm. Wow.
All of these are related, similar mechanisms, similar biochemical pathways. There's yet another one, which may make big news in the coming months or years. and that is something called hypochlorous acid, HOCl.
Mm-hmm.
It's similar to bleach. Bleach is Na, sodium, OCl, sodium hypochlorite.
I think I heard about that in the beginning of COVID because that's a very easy to make solution. You can do it at home and it's highly effective against all these microbes.
That's correct. And Trump got into trouble because he was right when he talked about bleach being effective for this, but he didn't really get the education he needed. So the press jumped all over him on this, but he was absolutely right.
Mm.
COVID could have been treated for less than pennies.
Mm.
That's how easy it is. Most viruses could be treated that way as well.